Hello, doctor. I've got pain in my shoulder. Do you think it is frozen shoulder?
Um, so I must say, this is actually a myth. Not all the shoulder pain is frozen shoulder. So there are multiple causes for shoulder pain. There are multiple structures in the shoulder which can cause pain, such as your rotator cuff tendons, your biceps tendon, your joint surfaces, your ACJ. So there are multiple causes. So classically, frozen shoulder is something different from these pathologies. And I get surprised. People come to my clinic and say that I had frozen shoulder and it got relieved in 10 days with physiotherapy. That's wrong. Frozen shoulder takes time to improve, actually.
And what exactly is frozen shoulder?
So frozen shoulder is a disease where the joint is surrounded by a thick capsule all around. So in frozen shoulder, what happens? The joint capsule becomes really, really thick, and that restricts the movement of the shoulder joint. It causes pain. Very good analogy is like the peas when you put them in the freezer section. Outside it's soft, but inside it becomes really hard. That's how the shoulder joint is in the frozen shoulder. It doesn't move.
Okay. And what causes frozen shoulder?
Most common association what we see with the frozen shoulder is diabetes. It's common in like 40 to 60 years old, mostly in women, but yeah, men also do have frozen shoulder. Sometimes it's secondarily to other diseases in the shoulder or after injuries, so that's what we call it a secondary frozen shoulder. Otherwise, primary frozen shoulder is more common than secondary.
How do you confirm it or differentiate it from other problems?
So it's mostly a clinical diagnosis, but there are certain tests which we should do to rule out other diseases. So when you go to a surgeon or shoulder surgeon, he definitely is going to examine you and he's going to make a clinical suspicion of frozen shoulder. But then a plain X-ray is important just to rule out something called arthritis, which can present in a similar way. If there is a suspicion of secondary frozen shoulder, then a scan come in the way.
How do you treat frozen shoulders?
So the most important treatment modality in frozen shoulder is physiotherapy. You have to have physical therapy. You have to do manual exercises, stretching exercises, range of movement exercises. They are most important. But sometimes if it's really, really painful, the patients can't do it. Then comes the role of steroid injection into the shoulder, intra-articular one, which reduces the inflammation and lets you do the exercises. But unfortunately, exercises doesn't work in all the patients, and occasionally we have to take a call for surgery.
And I've heard of something called as arthroscopic capsular release. Is it a major surgery?
Yeah, so that's a surgery we do commonly for frozen shoulder. So it's a very minor procedure. I would say it doesn't take more than 10-15 minutes. So what we do here is, we talked about the capsule, the thick capsule. We straight away go inside with the arthroscope. We put the camera inside and then see, and then we got a special instrument which is called radio frequency ablation. With that, we cut the capsule, and it doesn't take long. It's simple procedure, not a major one.
How long is the hospital stay?
So it's usually a day case procedure. You come in the morning and go off in the evening.
Okay. And any particular precautions to be taken after surgery?
Not much, actually. So you will be given a sling after surgery, just for comfort. But as soon as your pain goes away, you can discard the sling off and do your exercises. And here, after surgery, very important is to do rigorous exercises as much as the pain allows.
And how long would those exercises last, or the rehab period last?
So usually, if the patient is motivated, they get their shoulder movement back in about 2 to 4 weeks. But sometimes the rehab goes on for 6 weeks or 3 months.
Are there any complications in the surgery?
Yeah, so sometimes we do see recurrence, or we do get full movement on the table in the surgery, but patients do not get that movement back after rehab. Sometimes it's related to a bad controlled diabetes, where the tissues are very resistant. They form the scar again, and unfortunately, I would say very rarely we have to redo the procedure as arthroscopic capsular release.